Lukan Mishev with here this slide.
Dear colleagues, first of all I want to thank to Alcon and Professor Rizzo for having me here on the podium. I will talk about the Ngenuity, and these are my disclosures regarding the presentation. So it's an advanced digital imaging platform, and if we look in the center we will see a regular color eye. But around the color eye, we might see additional imaging modalities which can present new opportunities for us to perceive the ocular tissues. So, recently I heard the term middle segment surgeon, and probably when you deal with IOL explantations and implantation of other type of lenses, it's quite useful to have simultaneous image guidance as the Ngenuity 1.5 with the Argus, and I'm confident enough to implant even vivid toric in an IOL exchange scenario, because I know that the visual axis and the toric axis will be perfectly aligned, so it enhances my performance and my confidence as a surgeon. So this is an example of eye with hemophthalmos. Obviously there is no fundus reflex, and with the foot pedal of my constellation I'm able to control the Ngenuity menu. So I can cycle through pre-programmed digital imaging modes. Some of them are inbuilt, some of them are custom made. But anyways, I will be able to perform a cataract surgery here without using any dye. So is it beneficial? Probably yes. Since I'm able to see the transparent tissues, and playing with the color channels is actually enhancing our ability to perceive the ocular tissues. So here you can see the blue boost mode. You can see also another ones which are created by me. So it's all playing of the contrast. We need to think about tissue reflectance and then how to catch these reflectance. So here is an example how, albeit I don't have fundus reflex, I see the transparent capsule. So this is the beauty of the digital surgery or the digital enhancement of the image. We can extract more than meets the eye. So is it better than the classic analog microscope? I will leave the answer to you. Yeah, probably I will finish here the Rexis safely. And this is another example where an inbuilt filter can enhance your visualization of the vitreous without any dye. There is no triamcinolone here, there is no other staining agent, and this is a fresh retinal detachment. You can appreciate also the look of the retina. It is not natural, but we have a lot of contrast. So the digital filters are actually enhancing our tissue perception. See, perfectly well the vitreous is highlighted with a regular light. So if I see better, I believe I work more precisely and I do a better job. And if this type of visualization is not enough, we can actually enhance the visualization of the vitreous with the fluoroscopic vitrectomy. So here we have fluorescein inside the eye, and we have a digital barrier filter along with excitation light, so we can see really well the vitreous. And I was amazed to see how much vitreous is left in the eye after I finish my vitrectomy, because simply we cannot see it, it is transparent, and I don't believe that the other staining agents like a triamcinolone can penetrate the vitreous. They cover only the surface. So here is a beautiful example on that. We can also play again with the inbuilt filters, and I want to stress your attention over the NGF factor or Ngenuity factor. It is a stepwise approach of increasing the contrast and highlights in the image. And it can change how we see the stained tissues. And of course, if we see better, we will work more precisely. So you can see here changing the color modes and the intensity of the added modification. In that case, it is the Ngenuity factor. You can see now we can increase the contrast and we can increase or improve what we are seeing actually. This is another example of using the foot pedal of the constellation to control the imaging modalities. You can also appreciate the depth of field of the system because you see the jaws of the instrument on focus. So we need to mention that the Ngenuity adds to the depth of field of the microscope. So if we are better on focus, probably we will work a little bit better. So here is an example of ILM enhancement filter, and there will be a comparison between this filter and the inbuilt tissue detail mode or the blue boost mode. We need to cycle in between the filters up to the moment where we get the best image. Here it is, the blue boost, and I think it will provide you with better imaging quality. So, last but not least, we have the ability to perform intraoperative fluorescein angiography with Ngenuity, and I want to stress your attention on the vessel of the upper arcade, which is a reperfusion. It was a case of arterial occlusion. It changed our approach because we used heparin on perfusor intravenously, and we show a reperfusion here. So these are phenomena which we don't normally see, or we are not used to see or look for during our surgeries. So you can follow the blood clots actually as a small white dots traveling through the vessel. So the quality of the image and the resolution that we have is actually amazing. Since this is a vascular case, it is really important to treat or to decide if we're going to treat with laser or anti-VEGF based on something. So the intraoperative fluorescein angio might give us this, let's say, additional information. So you can see here how the perfusion travels through the vessels, and later on we will see end laser which is guided by the non-perfusion areas. So here it is, a good reperfusion. This is another case where we have again vascular occlusion, and you can see the intraoperative fluorescein angio, and especially the choroidal filling, so we can see all the phases of this classic imaging methodology. We can see where is the area of the affection, and we can do a diathermy under fluoroscopic view, which will improve the rate of our rebleeding later on, because we might be certain that we closed the vessels that are leaking. And later on we can do intraoperative navigation, because we know where we need to apply the laser. So if the impact of the high resolution, increased depth of field or dynamic range, and especially my favorite digital filters, are they changing the level of our performance? We might have a new tissue perception. We might visualize what we cannot see, for example, the vitreous. We have a functional imaging, fluorescein angio. We have intraoperative navigation, and the field is open for new opportunities. Thank you.
Thank you, Lukan Mishev.